Can you imagine this? A young, well-fit, 40-year-old male in the prime of his life, happily married to his beautiful wife and 3 great kids, suddenly having a life-altering event. Can this happen to you? Your workday starts off as usual, coffee in hand. A headache slowly starts irritating you. As your day continues, it gets worse. You take a couple of Advils, and it slowly decreases your throbbing headache. You drive home after work, and the headache still lingers. You arrive at home, still not feeling well. You decide to skip dinner. You take a couple more Advils and tell your wife you are going to bed. You awake the next morning, dizzy and foggy. You are unable to recall your previous day. You ask your wife, "What time is it?" There is no reply. You ask again, "What time is it?" Your wife looks at you, confused. What are you trying to say? In your mind, you are continuing to talk and explain why I haven't heard an answer. Your wife still doesn't understand what you are saying. As worry and panic sets, your wife decides to call 911, unaware of exactly what is happening to you. The seconds tick away as she anxiously waits for help. Your wife hears the sirens approaching. The paramedics arrive to your home, asks, "What is the situation?" Your wife is crying and distraught and can't provide a clear answer for them. The paramedics ask a series of questions, however, you cannot understand and have difficulty talking to them. Before the paramedics put you on a stretcher, they take your pulse and blood pressure and note them on their chart. You are now in the ambulance, sirens blaring, heading towards the nearest hospital. A stroke can be treated. Therefore, I cannot emphasize the importance of recognizing and knowing the 5 signs of a stroke. Weakness, trouble speaking, vision problems, headache, and dizziness. Taking immediate action by calling 911 can significantly improve survival and recovery. The longer the symptoms continue, the more brain cells or neurons in the affected area die. Get everyone in your family educated. Visit the Heart and Stroke website. Although this story is fictional, there are true facts that I experienced. My hemorrhagic stroke, or otherwise known as a blood vessel burst, happened in January 2009. I didn't have any pre-existing health issues, no signs of a headache. My stroke just happened. I am extremely lucky due to some very fortunate events. I recognized the stroke symptoms because both my parents had suffered strokes in the past, and 911 was dispatched. The ambulance arrived at Surrey Memorial Hospital emergency within 15 minutes. Surprisingly, there were no patients in the waiting room. I received immediate attention from the ER nurses and physician, and finally put back into another ambulance heading to Vancouver General Hospital Emergency Stroke Team. Everything happened within 2 hours of my symptoms. At Vancouver General Hospital, the emergency neurologist physician ordered a CT scan of my brain, where they found a pool of blood approximately 1 centimeter by 2 centimeter in the right basal ganglia. I was admitted to Vancouver General Hospital and transferred up to the neurology ICU ward. For 2 days, I was bedridden. I had compressed padding wrapped around both my legs, having to urinate into a bottle, and eating thickened food and liquids. It was awful and yucky. I was discharged from Vancouver General Hospital 5 days later, with differing levels of disabilities. A majority of my disabilities are invisible. Therefore, when you see me, I would simply blend into the crowd. I continually suffer from aphasia, numbness in my left foot, cold intolerance, and post-stroke fatigue. Invisible disabilities are very difficult to understand, diagnose, and properly manage. My name is Tony. I am a brain injury survivor, and proud to present to you a small part of my devastating event 5 years ago. Hopeful that my experience can open your mind to educate, be aware, and recognize the 5 signs of a stroke. Thanks for listening to my story.